Hi, my name is Carrie Matthews, and I'd like to talk to you about hearing impairment, the local and global impacts on communities and individuals. So to begin with a quote from Helen Keller, that deafness separates people from people. There are types of hearing loss that the CDC lists as conductive, sensorineural, mixed, and auditory neuropathy. There are also degrees, mild, moderate, severe, or profound. And there are other descriptions that the CDC uses: unilateral and bilateral, prelingual and postlingual, which means whether or not you acquired it before learning to speak, symmetrical and asymmetrical, progressive or sudden, fluctuating or stable, and congenital or acquired with delayed onset. So some current statistics. Around the world, there are 1.57 billion people who have some sort of hearing loss or hearing impairment. That was as of 2019, and that's 20% of the global population. So it's quite a large number of people. Of those, 403 million had moderate to severe symptoms after adjusting for hearing aid usage. That is actually an increase of 79% since 1990, which is pretty astounding. And also notable is that 62% of those affected are more than 50 years old. The WHO, the World Health Organization, estimates that by 2030, there may be up to 2.5 billion people with hearing loss or hearing impairment. And of the general population, more than 1 billion people aged 12 to 35, so quite a young population, are at risk due to recreational exposure to loud sound, and 1 in 5 U.S. teens suffer from some form of hearing loss or impairment. Also notable is that 2.7 million U.S. veterans have service-related hearing loss, and globally, 83% of those with hearing loss have an unmet need for hearing aids. So what's the global impact? Well, first of all, hearing loss and hearing impairment is the 5th leading cause of years lived with a disability, and there's a disproportionate early onset in developing countries. What that means is that there's a large percentage of live births which occur in developing countries as opposed to the rest of the world. So 127 million out of the 141 million babies who were born in 2012 were born in developing countries as opposed to developed countries. And in those countries, 6 out of every 1,000 live births have early onset hearing loss or hearing impairment. That's 3 times the rate in the developed countries. So as you can see, when you have the 3 times higher rate and then a large percentage of the babies being born there, you have disproportionate rates of early onset hearing loss in those developing countries. The greatest burden of hearing impairment is thought to be in the Asian Pacific, Southern Asian, and Sub-Saharan African countries. There's also a large global financial impact. The WHO target price of an affordable hearing aid is 3% of a country's per capita income, which excludes molding and maintenance of the device. So what that means is that for it to be affordable in Bangladesh, it would have to cost $26. In India, $43, Kenya, $26, Malawi, $10, and Nigeria, $43. Now we know that's pretty unrealistic because average cost of hearing aids is between $1,000 and $6,000. Cochlear implants are even more extreme. They can cost up to $90,000 over the course of a lifetime. So one interesting estimate is that adequate screening could save up to $1,000 per disability adjusted life year per person. And the WHO estimates that untreated hearing loss costs the global economy up to $980 billion per year. That's health costs excluding devices, that's education, that's loss of work productivity, and that's other societal costs. So hearing loss also has a significant impact here in the U.S. Of the Americans who have functional hearing loss, 77% of those who need the hearing aids would find it a catastrophic expense. So I mentioned earlier that hearing aids usually cost between $1,000 and $6,000 with an average about $2,500. And if everyone were to pay that to get their needed hearing aids, it would throw an additional 4% of the American population into poverty for that year. Also interesting to note as far as children and infants, 96% of 1-month-old infants were screened for hearing loss, which is recommended. However, only 40% of them got followed up with at 3 and 6 months, which are also recommended intervals. 22% of Americans are faced with hazardous noise levels at work. And another interesting point here is the income levels, that those individuals with unaided hearing loss on average earn $20,000 less than those with cochlear implants or hearing aids. So that begs the question, is it the chicken or the egg? Is it the cochlear implants and hearing aids that allows the additional income, or is it the additional income that allows the implants or the hearing aids? That's a good question. I don't know the answer to it. So there's also a significant personal impact and familial impact. On children, there's going to be impaired communication often, as well as a lack of literacy. There may be a lack of employment later on in life. In many countries, children don't receive adequate education when they are hearing impaired. And globally, there is a much higher unemployment rate among those who are hearing impaired or have hearing loss. Also, individuals may lose independence, especially as they age with hearing loss, and this may cause isolation. Anyone with hearing impairment or hearing loss may have loneliness, depression, anxiety, those sorts of symptoms, because they're simply not getting all of the conversation and the societal effects of being around other people. And I know this from personal experience with loved ones who are in the same room, even very close, but they're not getting the full conversation because maybe myself and someone else are having a conversation and we don't think to specifically include or look towards the person with hearing loss or speak in a raised or elevated tone. So it really takes some conscientiousness and conscious thinking of how to include those individuals who might not be getting the full conversation and getting all of the activities that are going on around them. In aging populations, there's also an increased risk of dementia and cognitive decline. This is a really important and interesting fact. So to summarize the barriers to treatment, there may be a lack of access to testing and treatment. That might be because of remote locations or lack of transportation, lack of qualified professionals, or an inadequate infrastructure. There might be a significant financial burden. In developed countries, that might be that insurance only covers part of the treatment. In developing countries, there may be no insurance at all, and the cost may be simply prohibited in relation to a person's income. There may even be a lack of hearing aid use even when somebody has them. I've experienced this with loved ones who simply don't like to wear their hearing aid. Perhaps that's because of stigma, because they're uncomfortable. I'm not quite sure. But research has definitely shown an improved cognition, social function, and mental health with use of hearing aids and correct treatment. So to summarize, what can be done? For children, there needs to be adequate vaccinations and treatments for diseases such as meningitis, otitis, HIV, TB, malaria, as well as measles, mumps, and rubella, which have all been associated with possible hearing loss. There needs to be adequate screening programs during infancy and also at school entrance. There should be also improved education aids such as speech, reading, and sign language, as well as early access to cochlear implants and hearing aids. Among the general population, there could be more screening programs as well as education for good hearing care. There also definitely needs to be more workplace safety and better access to hearing aids and treatments, such as at a lower cost or with adequate insurance coverage. So here are some resources as well. The CDC has a great website with lots of educational materials, also some in Spanish. The WHO has also a great website, as well as they have a really cool hearing testing app, which I tried out myself. That was really informative. And they also started a Make Listening Safe initiative to teach people about taking care of their hearing. The World Federation of the Deaf is an international advocacy agency for human rights. China, India, and Nigeria have established national ear care programs, and in the U.S. they are developing over-the-counter and online device sales, although that's still in the approval process and would need appropriate medical advising. So here are my references, and I hope that this was educational. Thank you very much.